Well, good morning, everyone, and welcome to our quarterly WorkWELL series. We're excited to have you all with us this morning. Today, we'll be talking about the impact of building design on human health and well-being, and we're really excited to have you all join us. Just to kick us off today, we will have a presentation by Dr. Whitney Gray from the International Wellbeing Institute, followed by two panelists, Lauren Dufort with CBRE, as well as Alex Conan with Arizona State University, talking about how they're putting well-building into practice. So really excited for our panelists today. Before we get started here, I just want to thank all of our sponsors, Blue Cross Blue Shield of Arizona, Equality Health, Cigna, Delta Dental, and the Arizona Diamondbacks. And with that, I will kick it over to our Wellness A to Z manager, Melissa Diaz, to go through some Wellness A to Z updates.
Hi, good morning, everyone. My name is Melissa Diaz. Thank you so much for joining us this morning. We're so excited for today's WorkWELL webinar. So just a few highlights that we have going on in Wellness A to Z so far. We currently have 121 employers. In light of COVID, we still have had some great employers join us that we've been able to support with our resources. We're so excited to have welcomed them. We currently are representing over 400,000 individuals in Arizona and outside of Arizona as well. In light of the COVID-19 response, Wellness A to Z has done a few different things to support our employers, including these WorkWELL webinars. So these are usually done in person, but we've transitioned to a virtual alternative so that we can still connect and provide support for our employers. And most recently, we have launched our Healthy Arizona Pledge, which is a pledge that where we are encouraging Arizona businesses and community members to sign to help us get Arizona back to being a healthy place to live and to work. And it's a simple pledge that can be signed just saying that we will follow local, county, and federal CDC guidelines such as social distancing, masking up. So if you all can, please sign that pledge, check it out and share it. We have a great toolkit put together for our employers that you can share via social media, via email. We even have a fun Facebook banner that you can share around your profile pictures. So we're really trying to encourage our community to just stay safe and stay healthy. So I'm actually going to turn it back over to Jennifer to introduce our first speaker because of the view here on my screen. So Jennifer, if you wouldn't mind, I'm introducing our first speaker.
Absolutely. So this morning I'm pleased to introduce Dr. Whitney Gray. Dr. Gray is standing at the nexus of public health research and places and spaces where we spend our lives, and has become one of the global voices for improving our buildings and communities in ways in ways that help businesses thrive. As Senior Vice President at the International Wellbeing Institute, she leads research and supports best practices in building design, operations, community development, and organization policies that can contribute to improved public health for everyone, everywhere. She led the development of the first WELL AP exam, the WELL faculty program, and the first case studies focused on the efficacy of WELL building standards. She helped launch more than 100 educational sessions related to WELL in 25 plus countries, and her lectures, webcasts, training, and published works have touched tens of thousands of designs and health professionals worldwide. So with that, please welcome Dr. Gray.
Hi, everyone. Hello, everyone in the virtual space as well. It's such an honor to be with you today. And as much as I love to be in a room with people and connect in that way, I think the virtual space has given us a chance to reach out into all corners of the globe and to really share a powerful message around why space and place matters to your health. So today I'm going to be talking about the WELL building standard. And I like to start by just kind of setting the stage is that many people don't realize that they spend about 90% of their time indoors. In fact, during this pandemic, people are very aware of this stat, more so than they used to. But to put this into perspective, if you're 40 years old, 36 years of your life have been spent indoors. And the professionals that are trained to design the spaces that you spend your time in have had no formal training in public health. Many of them want that training, but I've never seen a program globally that requires or mandates training in public health. Yet they are positioned to create spaces that you are spending a large majority of your life in. So the idea is we can do better, and I'm really honored to be with several panelists on the call today that are doing just that to try to merge these industries around public health and wellness and design the built environment, because we know that where you spend your time has a great impact on your health. Many people think it's their genetics or maybe even access to healthcare, but actually when we break down the largest determiners of health, it is your physical and social environment and where you spend your time, even down to the epigenetic level. That means what you breathe, access to food, how you move, access to light, thermal comfort, sound, stimuli. All of these things over time compound, and that equals really how well you're doing, right? So it's a really large determiner of health, and as such, we see a huge opportunity. So we spend time indoors. We have professionals that are trying to create better spaces, but we really need to have a standard, because what is a healthy place, and how do you define it? And is access to healthy food more important than access to nature and light? How do you even begin to balance that? So at WELL, we look at healthy places globally, and we look at the design, operations, and behavior of the people that spend 90% of their lives in those spaces. So our story starts in 2014, and it's really been a humbling and amazing journey. I've been with the organization since the very beginning, and as I look at this map, I think about the faces and the people that were first in those countries, first in the cities, between Melbourne to Belfast. These are individuals that said, I think we can do better, and they have. And so we're excited to stand in that we have almost 4,500 projects globally pursuing the WELL building certification that represents over 600 million square feet, and we are in 63 countries. And we are moving into our 6th year, in fact, just about to celebrate our anniversary coming up here in October. So the WELL building standard is but one of the products that we work on. We also offer the WELL health and safety rating, which I'll talk to you about, and that's in response to COVID-19. We're very excited to stand that up as a program that all businesses can participate in and be able to really quickly adapt without capital expenditures largely. We also look more broadly at the WELL portfolio, and we have the WELL membership program. And these are just all ways that you can get involved in working with us. And so we'll kind of go through these step by step. The first one, of course, is the WELL building certification. So that's the first building certification system in the world focused on human health and well-being. And you register to pursue the certification. You submit paperwork, but we also do on-site testing to make sure you achieve certification. This is a really big part of health and place, is the proof. And there's a real power in proof during a pandemic, in that we have to look at the data. So buildings that say they're healthy, can you trust them? And we really help to make a lot of the invisible visible, and that you might not know what's in the air quality, or the particulate matters, or the filter or ventilation system maintenance. What about happens when the building shuts down for a long period? What are you doing to control water issues, Legionnaires? What are you doing to improve the overall quality and experience of occupants by providing light and access to nature? And furthermore, if a person's in a healthy building, is it healthy if you're in the middle of nowhere and the only access you have is to fast food? We really look at all these different elements of health, and in order to achieve WELL certification, we do performance testing on site. where we use data as proof to be able to determine what truly is a healthy building that you can trust behind the numbers. So there's 10 categories to version 2, and version 2 just graduated from pilot and is ready. We are very excited how global this is. There's also scalable pricing, and so we've had a lot of updates as part of the version 2 that just rolled out. And I can talk about each one of these categories, around air, water, light, but I just wanted to preview to give you a sense of when you pursue WELL, we require that you pursue certain features, for example, in the air section. And then there's certain features that are optional, but it's important for us that any healthy building that's WELL has a smoking ban, for example. We require that you look at VOCs in your space. We want to see that you're doing regular ventilation maintenance, as well as looking at those filters. A very important issue right now as we're considering recirculated air and infectious disease transmission. And this is important. Many people don't realize that their indoor environment can be 2 to 5 times more polluted than their outdoor environment, and is actually not regulated in the same way their outdoor environments. And for those of us spending a lot of time indoors in our house right now, it may be shocking to find that according to the Global Burden of Disease Study, household air pollution was rated as the 10th most important cause of ill health. So increased attention to knowing what you're doing for good air quality is so, so important. Always has been, but I think is particularly highlighted right now. Another of our 10 categories is community. I wanted to highlight this because this incorporates a lot of policies that we ask a WELL building and WELL organization to include. And I'll put up there, community immunity has always been part of the WELL building standard, which is very important considering flu vaccines, for example. We also look at new parent and family support, something that as people are returning to work, trying to balance the demands of family, and what policies do you have in place to support that is really critical. And we're finding that our WELL projects are prepared, right, during this time because they've thought through a lot of these issues to be a resilient and healthy organization. So right now, workplace wellness programs are very expensive for organizations. It can be upwards of 30% more than your salary is spent towards workplace wellness benefits, yet few people really access them. We hope that's changing, but in the end, it often requires a call to a service or program outside of your organization, and picking up the phone can be difficult at times. Whereas we find that if we actually design a healthy environment, is that our goal is 100% of people have access to it because they're experiencing it. It's a passive intervention versus an active intervention. And so our goal in that way is that we reach 100% of the population in WELL-certified buildings to be able to gain access to the benefits of a healthy workplace. So there's multiple programs, as I mentioned. So we have the WELL certification I just went over. We also have the WELL AP program if you want to train to learn more about how you apply this with clients. We have a member program for those who want to be in our sort of extended family, and the WELL portfolio and WELL health and safety rating. So I'm just going to touch on these as a highlight. Things to know about our program is it is accessible and applicable to all building types. Very excited about our work to push this forward through our advisories, which means we have specialized experts coming in to give us more information about those building typologies to be able to adapt the WELL building standard to them. In March of 2020, we pivoted in response to COVID-19 to be able to provide the WELL health safety rating. And so anyone can sign up for this, which is true for the WELL certification as well. But this is a little bit shorter time span in which we're really encouraging projects that they select the features that apply most to their project, and they go through a step-by-step process with us in order to achieve the health and safety rating. The features include operational policies changing, maintenance protocols, emergency plans, and stakeholder education and training. And so we have really guidelines that are culminating from leading expertise right now. And I will tell you, leading research for organizations is that every single day the research is coming out on these topics. And so it's very important that we work with people so that we're culminating the best research that's out there and actually providing you a step-by-step guide of what can you do based on what we know. And the WELL Health Safety Rating is our real hope that it can provide that for all businesses to take those steps forward. To give you an idea of some of the research that we are focused on that is included in the WELL Health and Safety Rating is really looking at this issue of how pathogens enter the body. We are looking at particle size, aerosolization. We want to know how long does the virus survive in indoor environments, and what can you do? So there's a host of strategies. You've heard many of them. They actually will fall off the hierarchy of controls we use in occupational health to try to reduce down the risk of any environment. And within the WELL Health and Safety Rating, what we're doing is we're standing up the best strategies that we know to reduce that risk. Does that mean 100% of risk is gone? No. We're in a pandemic, right? But it is reducing the risk to the best of our ability with what we can do. So we control what we can control. And this gives you a little bit of the research and information that we're using to be able to advise people on cleaning and servicing, ventilation, on the types of filtration to use, around the recirculation of air, around demand and control ventilation systems, as well as looking at things such as practices in the building of hand washing. We're looking at material safety, for example. So all of this really culminates into, again, the best strategy we have to provide to people responding to COVID-19. And for those pursuing WELL, this is basically a subset of the WELL features in version 2. So you can easily go on to pursue WELL certification in its entirety. So here is the journey for the health and safety rating, as I mentioned. So you enroll, you customize your approach based on where you are at and what your needs are. And then you're able to achieve the rating. And in doing so, we really mean that you can look for the seal, which means that you can use the health and safety rating in order to convey to your occupants in returning to work what you've done in order to protect their health and reduce the risk. These are some of our partners worldwide: RMZ, EcoWorld in Bangalore, the Skyview in beautiful pictures here. We also, the Monarco Towers, we're very excited to have them join the health and safety rating. And for those sports lovers, the Yankee Stadium in New York has achieved the health and safety rating. So this is the program. Please inquire if you want more information, but we would like to reference that to trust a building and make the invisible visible, that you do look for the seal. You don't have to trust that people are telling you they've done it. They can actually verify and test and track that performance, which proof is very powerful in the time of pandemic. Businesses that are interested in learning more would like to be able to review multiple properties within their portfolio. We encourage you to consider membership, which gives you a lot of benefit to our education programs, to our training. These are lots of our friends and colleagues worldwide that make us better and that are part of our extended family that are every day looking at how they can adapt their spaces to be healthy and well. So with that, I also wanted to preview some additional tools for businesses that I know are on the line. I talked about testing and tracking performance. We've recently launched the WELL Portfolio Program, which allows you to test and track across buildings, as I just mentioned. This gives you a little bit of a snapshot on the dashboard that you can compare your properties. So if you're looking for an intervention around WELL for one building and you want to see how it would play out across your portfolio, this dashboard allows you to test and track that, which is really important. And also on the investor level, for those of you that are reporting to your stakeholders around how you're investing for the health of your people, we really turn to our work with ESG rating systems, corporate sustainability reports. And we've heard a lot from our clients such as Barclays around how can you make sure to help your clients and stakeholders know what you're doing around human health, particularly when it has been at times challenging to be able to test and track that. And we do that really through our Investing for Health platform. We are partners in looking for ESG rating systems such as GRESB. We're actually participating in GRI, and we have a website that we've stood up that really goes through, step-by-step understanding of how can you test and track health and wellness in your environment? What are the challenges, and how do we need partners to help us do that? So with that, I'll just close it out that today really my goal is to get you excited and kind of really thinking about how place matters in health, and that you as organizations have an opportunity to create healthy workplaces where your people spend time that even goes outside the four walls, because those four walls have changed these days, and that reach out to us to really be able to test and track what you're doing in investing for health through the WELL Building certification, and more broadly through our family and network of partners who I think more now than ever are committed to really rethinking about health in buildings. Thank you so much.
Well, thank you very much, Dr. Gray. As someone who loves the outdoors, it's really disappointing to know that I've spent over 40 years indoors at this point in time. So we're going to have to look at our air quality in our own house, being that we're in our own four walls these days. With that, I would like to welcome Lauren Dufort, who is the Program Manager for Global Workplace Solutions with CBRE. And Lauren provides strategic oversight and manages LEED and FitWell certification projects from inception, it's not football, inception, all the way to completion. And Lauren has over 15 years of experience as a leader in sustainable program development and project management, including but not limited to LEED and FitWell certification management services. Prior to joining CBRE, Lauren was the Acting Deputy Sustainable Director for the U.S. Center for Disease Control and Prevention. I don't know that I would want to be there right now, so that was probably a good shift for you, Lauren. And in that role, she participated in the development and launch of the FitWell rating system. She also served as the key program director for the Atlanta Better Buildings Challenge, an initiative directed by the U.S. Department of Energy encouraging property owners in the central business district to reduce energy and water consumption in commercial buildings. I'd also like to go ahead and introduce our third panelist today, Alex Conan. Alex is a 1996 graduate of the U.S. Naval Academy with a Bachelor's of Science in Aerospace Engineering, with a focus on astrodynamics, way smarter than I am. He holds a master's in engineering and environmental engineering, which is water quality, from the University of Florida, and an MBA from Colorado State University. Very, very well educated. During his 20-year naval career, the focus of Alex's work was on facilities and construction management. And Alex recently joined Arizona State University as the Executive Director of Facilities Management and is currently the Assistant Vice President of Facilities Management and a PhD student in sustainability. Before we get started and before I turn it over to Lauren, just a reminder to everyone, if you do have questions for our panelists, please go ahead and drop those in the Q&A box or in the chat box, and we'll cover those during our Q&A session. And with that, I will turn it over to Lauren.
Thanks, Jennifer. Good morning, everyone. So I'm here to talk about how we as building owners, operators, and occupiers can influence health. CBRE has extensive experience with implementing workplace well-being initiatives, both with our clients and in our own offices. We achieved the first WELL certified office in Los Angeles, and just this year we've certified 5 new offices under the FitWell certification program, which is another program similar to what Dr. Gray just went through. So we're really proud of all the achievements that we have accomplished in just a short time in our own offices. So today I'm just going to highlight a few of the examples. So here you see a couple of pictures from our recently FitWell certified offices. As you can see, there are a lot of different work zones, if you will, or workspaces to accommodate different work styles and, sort of encourage collaboration, which, as we know, is a huge component of emotional and mental well-being, to create that sense of belonging. And here you'll see there's a shot here of one of our break room cafe market areas, and I'll get a little bit into some more detail on the actual food, but I just wanted to point out that we've got nutritional educational signage throughout these areas to influence healthy choices when it comes to grabbing that 3 o'clock snack. So here are just some examples of how you can implement well-being initiatives in your workspace. We have active workstations for all of our employees in our offices, as well as wellness rooms or rooms for nursing mothers, and then hydration stations throughout the space. As we know, staying hydrated throughout the day is very important to well-being. So interconnecting stairwells are a very important component in all of our offices that occupy more than one floor. We like to encourage physical activity wherever we can in our space, because as we know, physical activity promotes long-term health, and anywhere where we can get moving throughout the space is going to be a benefit of workplace being. So we've got signs throughout the space to encourage people to take the stairs wherever they can, as an alternative to taking the elevator. We also want to make sure that the stairs are actually a more attractive option than taking the elevator when it comes to moving throughout the floors. We also like to use what we call choice architecture to implement some nudges throughout the space. We don't want to go cold turkey on, taking away things that people want throughout the day. But we want to basically create an environment where it's easy for you to make a healthy choice. So some examples of what we do here are we always have free fruit placed throughout the office. So it's easy just to grab an apple as opposed to having to go somewhere else to find that candy bar. We also have signs throughout the space, as I showed before, that just sort of nudge you to make a healthy choice as you're sitting there thinking about what you want to grab. And then lastly, we have, everybody needs a soda every now and then, and we're not going to, take anything away from anyone. But as we're trying to move towards more nutritious options in our space, what we want to do is drive you to make a good choice. So we're putting things like water and sort of the healthier alternatives at eye level or at the top. So you sort of have to seek out the Monster energy drink towards the bottom. And so those sort of subconscious nudges are actually driving people toward healthy behavior. And then lastly, as we talked about, hand washing is very important to health right now, of course, and always. So we have signage throughout the space to encourage people to wash their hands. Hopefully that's something that becomes an obvious second nature behavior, post-COVID. But we just want to make sure that people have the opportunity to wash their hands and are reminded of the benefits of doing so. So this year, we have been conducting extensive research and surveys just to understand what the workplace of the future will look like once we do get back to work. And as we know, one major component will be workplace flexibility and agility. As we've seen, the COVID-19 pandemic has significantly accelerated the desire for remote work. This survey is just a selection of our large workplace clients that shows a dramatic increase in the desire for remote work. We went from 3% to 73% in just 1 year. So along with things like safety and belonging, autonomy is a key component of a person's sense of well-being, and it's important that we allow employees to continue to balance their work and life responsibilities as we navigate this new normal. However, there'll still be a need for social connection and collaborative space, even if it is reimagined to accommodate social distancing and enhance cleaning protocols. But the workplace strategy is rapidly evolving toward a hybrid approach that includes remote work and options that provide space for collaboration when needed. So another survey of our clients here just shows that 45% of companies do intend to implement well-being measures in their offices once they return to work. And so we're helping our clients determine what those measures are, and then also helping them measure the return on these investments. As we've seen through some recent studies, the return on investment for well-being initiatives can be as high as 6 to 1 with savings and increases in employee productivity. So, in these reimagined office spaces, one thing is clear: well-being will be a key focus. Thank you, everyone. Please feel free to reach out with any questions.
Thank you, Lauren. And we'll go ahead and segue into Alex from Arizona State University.
Hey, thank you, everyone. Kind of give it a quick second so I don't get too far ahead. One of the things that I guess I'm here to talk a little bit about is some of the more, I say, mundane aspects of all of this COVID response. I am not a wellness expert by any stretch of the imagination. I'm the guy who fixes toilets and makes sure you're not too hot or too cold, or when the lights don't come on, I'm the one you call. So we have, but when this all happened 6 months ago, and we went to a completely remote environment on ASU, we tasked a committee to talk about the physical presence and how we were going to resume teaching in a physical environment for the fall semester, and what it would take to make our buildings ready to do that. So we had some guiding principles as we laid those out. How do we ensure the health, safety, and well-being of our students, faculty, and staff, and even the community? We have a ton of vendors who come on campus. Our custodial is all done by a third party. So we have almost 800 people from their team coming in every day. So making sure that the community is well taken care for was a priority of ours. Innovate support of our core teaching, learning, and research. Most of the research in the laboratory environment had to continue to occur. So we had to find a way to make sure that we were addressing their concerns and their needs very quickly, and how we can make changes. For those of you who've been tracking, CDC guidance doesn't stay very stagnant for long. We've had several changes between mask, no mask, masks, 10 minutes, 15 minutes, 6 feet, or a mask, 6 feet and a mask. So we had to make those changes on the fly. So let's see if I can get to the next slide. Okay, so to do, sorry team, I'm going the wrong way now. Can I go back? Thank you. That one right there. So the physical presence team was broken into essentially 6 parts. How we wrote the guidelines, what type of cleaning protocols had to change, what type of health screenings and social distancing / safety concerns, personal protective equipment, building access, and then how we were going to deal with the non-core, which were our supply chain / vendors out there. And Melissa, if you could just help me, next slide. Thank you. So basically, we came up with a plan to address the 6 feet of social distance. We had a ton of discussion on signage and how we were going to lay that out. This is just a very brief look at kind of what those signs look like. We had to discuss how we were going to teach classes where an instructor had to face students, talk, and in some cases, we have people who read lips, and how we were going to provide a safe environment for a professor to not cover their lips while they were speaking with a student who needed that accommodation. So that became an incredible challenge. We had meetings twice a week with stakeholders that ranged in numbers from 10 to 100 when we would debate what issues we came up with and solutions. We drew the polygons on maps to see how many people we could actually fit in the space, what would work best in the environment, and what adjustments we need to make. So if you go to the next slide. What we came up with was basically every other seat and face coverings everywhere. That it sounds pretty obvious and pretty simple, but I tell you, to get to this point was probably several hundred man hours worth of work. We put stickers on every seat. I do want to remind everybody we're trying to control behavior of 18 to 22-year-olds who have just left an authoritarian environment known as mom and dad to a completely open environment known as college. So this was not the easiest transition to make. in this COVID environment. We do twice daily cleanings in these spaces, and then we have hand sanitizing stations. But personal responsibility became a huge aspect of this discussion. We put cleaning supplies in at every door, and students are responsible to clean their workspace before the beginning of every class. And the instructor is to remind them to do this. We learned very quickly, especially speaking to our social scientists out there, that if you don't have them clean before they start, you ask them to clean afterwards, human nature is to forego that process. So it had to be at the beginning. And that was another several man hours of discussion of beginning or end of class. Okay, next slide. The other thing we wanted to do is one of the aspects of this was students, about 50% of the students attend the class in person, the other 50% take it online, and they rotate that throughout the semester between maybe Monday you attend class, Tuesday you take it remotely, Friday you attend class, and then you reverse it the next week. So we had to have spaces for students to go between classes if they were to have an online in-person class sandwiched in between. So we added outdoor rooms. These are some pictures of what those look like. We're testing these to see how much business we generate. We also added 1,000 chairs throughout the campus, 250 tables, about another 250 benches. And the one thing we learned, as all dining is now grab and go, we had to add about 100 additional trash cans that we didn't anticipate. So that was a big challenge for us, and coordinate and synchronizing all those events. Next slide. And then the last thing we did is, like I said, personal responsibility. We handed out every one of our students a community of care kit. These are the contents of those kits, and they got 2 masks, they got hand sanitizer, they got wipes, they got our thermometer, and we bought about 100,000 of these. About 40,000 left right now because certain populations have chosen to use the remote option for the time being, and we're seeing that slowly start to grow back as students start to believe us that we're here to stay. Several universities opened and then rapidly closed there afterwards, so we think that scared quite a few of our population off, but we've been going strong for over a month now, and we don't intend on changing that moving forward. Next slide. And then supply kits, this was what we put in the classroom. I talked about this briefly, so that everything can be cleaned down by the students and they can participate actively in helping us kind of manage how the building's going to operate. I will say that one of the biggest questions I typically get is on HVAC and what we're doing about HVAC. For the most part, our systems were compliant with the ASHRAE guidance, so we didn't do a ton. Arizona is difficult to add a ton of fresh air to it because of just the temperature differential we see here. It won't, the systems as they're been optimized for low energy just can't support huge swings in temperature changes like we would. But we are doing the code compliant fresh air. The one thing we were most concerned with was making sure that we didn't create turbulence within a space. So we're making sure that all of our ductwork is pointing directly down and we get a downdraft rather than a turbulent flow. And that was something we spent a lot of time on. And then we made sure that everybody was at the MERV 13 level of their filters. So we were maximizing the amount of filtration we were taking when we reclaim that air and recycle it back into the space. Okay, next slide. I believe that's it. Oh, more supplies. And last slide, please. And that's it. So open to questions.
Well, thank you so much, Alex, and Lauren and Dr. Gray as well. I love the diversity of this panel. We have Dr. Gray conducting the research, Lauren putting it into practice, and then Alex, you're the one at the end of the day that has to implement all of this and make it work. And the little things like trash cans become really big issues if not handled. So again, as a reminder to all of our attendees, if you have questions, go ahead and drop those into the chat box. Just to get us started, and I'll let anyone take this, but I think more and more companies are starting to go back into the workplace. So what are you seeing as just some easy guidelines that businesses can follow as they start to bring some of their remote workers back into the office?
Sorry, was that me?
We'll start with you. Sure.
I think the biggest thing that you can do is really communicate the plan openly. Hear those questions up front. We did a lot of town halls with our staff as they came in. We did something similar to what we're doing right now, where we allowed Q&A to come back and forth. We had the college deans talk to their professors, and we collected a lot of those questions. We adjusted. We found out, your plan is probably about 80% good. And then the questions modify it. I think one of the biggest gaps we had was in the School of Music. They have to do full voice, and you can't do a face covering on full voice, and you can't make a plexiglass box. So we did PVC pipe and shower curtains. That's how we solved that problem. And that was actually their idea. And we just implemented it. And that was a great one. If we hadn't had that dialogue, we wouldn't have known that out there. We do some things for purely psychological reasons. There's no science behind it. And that's okay to a degree. We got to be a little bit careful. And the last thing we constantly strike with everybody is this will end. We can be better for it. But someday I'm going to get to shake hands and hug people again. So let's not do anything that doesn't let us do that a year from now.
That's absolutely right, and I can't wait until we get to that day. Lauren, I'm going to throw that question over to you as well, as you see companies that you're working with going back into the office. Recommendations?
Well, to echo Alex, I would say communication is key. And, if you're a tenant in a building, it's important to partner with your landlord and just get a really clear understanding of what's happening in the building to keep you safe, and communicate that to your employees so that they feel okay coming back to work. And then the other thing that we're seeing a lot of is, there's this balance between work from home and work from office. And I don't think that any one is going to be any more popular than the other going forward. I think we just are going to get creative in how we design our spaces to be, if you're sitting at a cubicle all day and you're at the point where you need to have tall partitions around you and your head down, you should be working from home. But, if you want to create a space where you can collaborate safely, that's also important as well. So it's good to have both options.
That's great. And the Chamber is actually looking for a new home as well right now. And CBRE is assisting us with that process. And that's one of the things that we're looking at is how do we change our culture and change our structure so that when we are in the office, it's a collaborative, intentional collaboration versus those times where you need to put your head down, making sure that those are work from home days. And that's gonna be a culture shift for us. So
I'll just add on that. I think it's a really powerful time for us not to be reactive, but to be proactive. The first month or two, it was, okay, this will go away. And it's not going to go away. In fact, unfortunately speaking, in public health, we knew this was coming. We did not know the name of it or the exact date. But I think that we would be remiss if we don't shift the way that we design to better understand how people use space, how they need to be connected to each other, but how design is brilliant at creating solutions and problem solving. I have great faith and confidence in how innovative, we're seeing companies step up to try to find some of these solutions. And the solution's not just stay 6 feet away from someone. In public health, that's the last thing you do in a personal protective equipment is that you try to reduce down any of the design and operational administrative controls so that people don't have to use PPE. with all that said, I think this is a powerful time to invest in health and not just react to a problem, but to create a solution. I will echo the other presenters in saying, this is just as much about design and operational strategy as it is about communication and behavioral change. If people don't trust you, if people don't trust their building, then you need to start right there. That's kind of what we're working on with the certification system, that people can represent that by looking and seeing a certification plaque where it's like, okay, I know they've done this much. But, Alex, your people, you're the front line. Unless they've heard from you, it's very hard to create that trust. And I really think the onus is on building professionals that maybe have been uncomfortable to reach across, the aisle at times to be the leaders here, to be the voices, to say what we do is critical. And we're here if you have any questions. And Alex, I will call you out as someone seeking out their PhD. You're not just someone that fixes the temperature. You're deeply invested in understanding these systems, and we need leadership like that is the voice of helping people be able to trust their communities and their buildings.
You're not the first person to call me out today, Dr. Gray, so that's fine.
Couldn't agree more. And Dr. Gray, there's a question in the Q&A box. What are some of the basic things that homeowners can do to improve the air quality? And I will throw that over to Alex with his PhD as well to answer for both of you. So we'll start with you, Dr. Gray.
Oh, I was like, Alex, I call you first. Okay, sure. So this is going to vary. Are you in a city with outdoor air that is healthy or not? There can be certain issues around pollution of the outdoor air. You can actually check on EPA's website to understand what the outdoor air is like. But I would really start there. So when it comes to making your home safe, there's a couple things we're thinking about. We're thinking of indoor contaminants, outdoor contaminants. We're thinking of source control materials. And now we're thinking about viral load. Right? So the simplest thing I can say to you is open those windows. If it is safe to open them, what that does is it oxygenates the air, right? It potentially decreases the viral load within that space and helps to circulate, right? You will remember the history of sick building syndrome, right? So this is when we tighten buildings up and we said we need to maintain the energy of the building. And it's complex how this came forward, but I think a lesson learned in that when we open up the buildings and allow them to breathe when we can, it can be very powerful. Not all building typologies, not all places can do that. Secondly, test and track. There's lots of things in the market today that allow you to basically test what is my indoor air quality. I think it's super powerful. For those people dealing with respiratory, asthma issues, get the data, know where you're at. Those are pretty accessible to do today. You're going to want to change those filters, please, please, please. So ventilation maintenance is a big thing that people don't even realize and recognize. And then upgrade those filters. We talked about MERV 13. Those filters are going to allow you to basically capture those smaller particles, which can potentially carry viruses on them. And then comes filtration. So if you want a standalone filter that's next to you or next to your breathing zone. And I'd be remiss not to say there's a host of other solutions that we can talk about, but I do want to just put forward, think about nature. We have seen success in looking at these green walls and incorporating nature into space to help you, reduce carbon dioxide load, for example. And there's other benefits that having plants and nature in space can have. So there is a variety of solutions. I'll pause there and have Alex fill in the rest. And there's a step-by-step guidance for us in the WELL Health Safety Rating for people to know how to go through each of those things and try to apply it to their home environment. But, start now, I would say. Don't wait for there to be, another problem in this way. And I think it's really powerful because you can take this into your own hands as well.
Yeah, I would say that you pretty much covered everything, but to localize it a little bit with us Phoenicians right now, hard to open the windows right now, but I would say about 10 o'clock at night, you absolutely can open the windows right now. And I don't think a lot of us are doing that since we're so used to it being 98 degrees at 10 o'clock at night with it. The other thing is the air isn't great here. We've been on what we call no blow days here on campus now for the majority of the summer because of our air quality issues. So I would say dust control is absolutely something you can help out in your own space. Just like you do a fire protective barrier when you're in a wildfire zone, you should do a dust control check on where you're at A lot of those bare spaces got barer this summer since we've had record heat out here. So what you're going to do about that? And then I do think that the number one thing every homeowner should do and does not do is check your air filters. You're not doing it. And even if you think you are, you're still not doing it enough, because the manufactured recommended enough is not enough here. It just isn't. We pull in way too many particulates to make that 6-month check good enough. It's probably closer to 3 months here. I would caution you to buy a lot of gadgets and gadgets right now. There are a ton of people on the market trying to benefit from this. My personal opinion on UV right now is I'm going to wait for Dr. Gray to do a lot more research on it. That airflow is pretty fast moving past that fan motor for that UV to have a lot of effectiveness with it right now. So that's something I wouldn't do, but just the general tune-up stuff. That people tend to think, hey, I'm okay with it. Ask yourself, when's the last time you changed the air filter? And my guess is you cannot remember, and that's a problem.
Alex brings up such an important point that you have to localize your solutions. And then also, I think not for nothing is that there's a lot of very expensive solutions that are out there, and there's some very basic things. People, they want to jump into an air filter, but they haven't actually changed their own filtration system in their within their own ventilation, right? So they're trying to buy a standalone unit when they haven't even addressed the filter in their own HVAC. So I think there's some simple, straightforward, and very localized, strategies. I really appreciate, Alex. It's, when you make general comments like this, is that each area is so different and unique, which is why we rely on our facilities folks to be those frontline voices. Again.
That's great. And I think a good segue into, what are some of the most cost-effective things that businesses can consider implementing in order to improve their health and well-being of their environment? Lauren, do you want to start that one?
Sure. I mean, so, there are short-term and long-term things. And in the short term, I think, it's just being creative with how you occupy your space in terms of density and, work type, figure out who's essential, who needs to be there, who can still work from home. Again, this is temporary, so we're not asking you to, reimagine your entire real estate portfolio, but, it's just kind of, how can you be creative about keeping the density low in your space? And also, again, communications, making sure people understand the etiquette where, you don't linger at someone's desk for a long time, anymore these days. That will come back, but not right now. And then in the long term, it's I think, finding ways to promote long-term health and keep people from developing chronic disease conditions that would be a problem in a pandemic situation. So programs like group walks around the office, or, cooking classes to learn nutritious recipes, just things to promote well-being and health in the long term to keep everyone healthy.
Great. Dr. Gray or Alex, anything to add there?
Alex gets to go first on this one.
Wash your hands. I think it's amazing to me that that the shock that I hate to say it, but if you go into a bathroom and you're standing next to somebody, how few people actually wash their hands properly. So we've put up signs in every building on exactly the steps it takes to wash your hands, and I think that would help a tremendous amount to kind of make us a little bit more viral resistant here. We also added about 3,000 hand sanitizing stations across the campus to try to add that out there. I'm obviously the more pedestrian of the solution sets here, but that's the one that just blows my mind that we're still struggling with as a society.
So I guess I'll also add that this is not just a one-time fix. So the first thing I think a company needs to do is not just look for the cheap and easy thing to do, is that you really do an assessment. And I think what you've heard all the presenters emphasize is that there's some very direct things that you can do as far as the building is concerned. There's also some very important things you need to do on communication, risk management, and behavior change. And take a look at this list for WELL health safety rating. We have 21 strategies that you can apply today. And I'd sit down right now and figure out which ones can you do, and then I would defend which ones you can't, because you may be asked down the line if something happens why you didn't. And it's good to know where you stand and where you're going, and then to do what you can do today, and then sort of start to phase in what you're going to need to do over time. And a lot of these approaches only work in conjunction with each other. Right? So it's not that you can only stay 6 feet away. People don't understand that concept because we're now deeply understanding aerosolization, how far, how long. We're looking at fomite transmission, right? This stuff is still emerging. And so it's not that 6 feet is going to save you alone. It's part of a complex strategy in which you're understanding density reduction, you're trying to reduce viral load and reduce risk. But I will, maybe on that note, just support Alex as a public health professional in saying it is one of the longest standing strategies we have. And in fact, the #1 strategy in the 1918 Spanish flu pandemic was wash your hands. And people forget this, but coronavirus, because of its lipid layer, is that basically soap is one of the most effective ways at being able to remove it, while also containing the good bacteria that's still in your hands that you do need, that people forget about, right? So, I do get a little worried that people just feel like they can Lysol themselves down and that's going to protect them alone. Is that you actually have to think about host resiliency, and that's not about removing all bacteria, right? It's about clean practices that can reduce this pathogen, and that's why hand washing is so, so critical.
Absolutely. And I know we're running short on time. So Alex, there's a quick question for you. Where did you get these supply kits?
Oh, I saw that. We hired a third party to assemble it for us, and I don't know, but I'll pass that on to you and Melissa so you can share with the broader community. But it was a vendor we went through that our supply guy is just freaking amazing around here. Everybody was panicked. They couldn't find this, they couldn't find that. I went to the warehouse and there was 40,000 of the things nobody could find. So we ended up having to give N95s to the healthcare community because we felt bad. We had way too many here by the time he finished. So,
well, maybe you could send some of those supplies my way. I know we're out of wipes and I can't find them anywhere.
I bought about $250,000 worth of them before they ran out because my supply guy was so smart. So yes, I could probably help you out.
Great. And just before we close, any closing comments? And Lauren, let's start with you.
I think that in an unfortunate situation such as COVID-19, I think a lot of good things are going to come out of this. And I think the workplaces of the future are going to be great and, healthy. And I'm excited to see this new trend.
Couldn't agree more. Dr. Gray?
I think businesses have a fundamental role to play in the health of their people and the community. The Surgeon General will be publishing a report in the next couple of weeks talking about how economic prosperity does depend on business. And I think given the current climate, it's not a wait for there to be regulation or policy, wait for someone else to do it. It's who is going to do it in your organization and protect health. And increasingly, you're going to see workers demand that their organizations are investing in their health and asking hard questions. So although some see this as something they have to react to, others see it as an opportunity to be proactive and better communicate what they're already doing around investing for health as a business.
Great. And Alex, any final comments from you?
The one thing I would like to say, caution people to, is one of my biggest concerns through all this is that we've let kind of sustainability become an or rather than an and as we move forward. And so disposable plates because we want to do dine out, and 100% fresh air, foregoing the energy efficiency gains we made over the last decade by being more optimal with the way we use energy. It doesn't have to be an or, it can be an and. For our dining facilities, they're giving a discount by doing reusable plates that they will sanitize when you bring them back, and we can find new solutions here. But in the rush to reopen and get people back, I understand you've had to do one or the other, but now that you're here, let's try to do both. Let's try to be energy efficient. The environment's going to be every bit as important as our health and well-being as we move forward, because as Dr. Gray put it, If you want to have better air quality, you better be able to open the windows. Well, if we're burning a lot more carbon to get there, the windows opening isn't going to be better air quality. So let's not make it an or, let's make it an and as we move forward on the sustainability.
Really great point. And I just want to thank all of our panelists today. Some really great information shared. So thank you for your time. Also, thank you to our sponsors again for making today's event possible. Just a couple of quick updates for everyone. We have our first Spanish WorkWELL webinar coming up on October 29th and hope you're able to join us for that. We also have our next PlayWell workshop coming up on November 18th, and we'll have our WorkWELL in December. So moving these to monthly events instead of quarterly events in response to COVID-19, and hope you can join us. I also encourage all of you to join us in taking the Healthy Arizona Pledge. I dropped that into the chat box so you can access that link there. And thank you again, everyone, for your time, and go wash your hands.